Hello, and welcome to Chapter 3. Today we'll be talking about assessing children's health. Health problems can interfere with a child's ability to learn. Teachers have many different tools to obtain information about a child's health. Health information can be used to assess and monitor a child over time, to identify developmental problems, formulate intervention plans, make referrals and work with service providers, and to evaluate a child's progress. The nature of the information requested on health history forms varies from program to program. The information is most often used to understand a child's current developmental progress, any special health conditions or needs that they might have, their daily habits and preferences such as eating and sleeping patterns, or words used to express personal needs, and their concept of family. Most states require children to have a complete health assessment and current immunizations before they attend school or an early childhood program. The Body Mass Index is a relatively new screening tool that provides a height to weight ratio. Most of what young children learn is through their senses, especially in their early years. They use their sensory organs to understand the world around them. Their sensory organs would be their eyes, ears, nose, hands, and mouth. Teachers are with kids all day long, and they see them functioning in a variety of different contexts and can observe behaviors that may indicate a sensory problem. One common type of sensory problem is vision. Some early signs of vision abnormalities in infants and toddlers might be rolling eye movements that are suggestive of blindness, jerky or fluttering eye movements, eyes that wander in opposite directions or across after 3 months, the inability to focus or follow a moving object after 3 months, the pupil of one eye larger than the other, the absence of a blink reflex, drooping on one or both lids, cloudiness on the eyeball, or chronic tearing. And these can be found in a teacher checklist on page 60 in your textbook. Teachers may actually be the first to notice clues in a child's behavior that suggest a vision disorder. Teachers and volunteers can actually be trained by healthcare professionals to administer many of the standardized vision tests, and they do so within their own schools. And if they see a need, they will talk to the parent and give them a referral for an ophthalmologist or an optometrist. There's a new photo screening process that is relatively new that is being used with young children who are pre-verbal, nonverbal, or have developmental delays, which is pretty awesome. There are 3 types of vision disorders that are common among young children. The first is amblyopia, or what is commonly known as lazy eye. There's strabismus, which is most commonly referred to as cross eye, and myopia, or nearsightedness. Each year, approximately 12,000 infants in the United States are born with hearing loss. There are several behaviors that might indicate hearing loss in young children. One might be frequent mouth breathing, failure to turn towards the direction of a sound, delays in acquiring language development, or poor speech patterns, difficulty understanding and following directions, asking to have statements repeated, rubbing or pulling at ears, mumbling, shouting, or talking too loudly, reluctance to interact with others, quiet or withdrawn, using gestures rather than words, excelling in activities that do not depend on hearing, imitating others at play, responding to questions inappropriately, mispronouncing many word sounds, having unusual voice quality, or failing to respond to normal sounds and voices. And this can be found in a checklist on page 65 of your textbooks. There are some common procedures for evaluating hearing in children. The first one is done in the hospital for babies who are born in the hospital right after birth. And then at their well checks, as they get their checkups with their physicians or their healthcare providers, their hearing and vision will also be checked at that time. The most common forms of hearing loss include conductive loss, which affects the volume of word tones, and sensory neural loss results when the structures of the inner ear or the auditory nerve have been damaged and do not function properly. Teachers who understand how various impairments affect children's ability to hear can take appropriate steps to improve communication and modify learning in a variety of different ways. There's a checklist on page 67 of your textbook which has some wonderful examples of that. We are able to use knowledge of developmental milestones to evaluate speech and language progress. Although many factors influence children's speech and language development, the ability to hear is especially important during the early years, and a hearing test should be the first step in assessing a child who may have a speech impairment or delay. And as always, a referral to a professional evaluation should be made if there are any concerns. The quality of a child's diet has an unquestionable effect on brain development, behavior, and health. There are a variety of assessment tools to evaluate a child's nutritional well-being. One is the BMI. There's also the appearance and behavior that a child has on a daily basis. That would provide the initial indicator of a child's nutritional well-being. And there are also additional assessment tools that can be used if necessary. There are two common nutritional disorders, and they are malnutrition and obesity. Malnutrition is a lack of sufficient food or essential nutrients, and it could be caused by limited access to food and unhealthy food choices. Obesity is commonly due to a combination of excess food and calorie intake and an inactive lifestyle. Obesity affects approximately 33% of all children in the U.S., and the primary factors point to inactivity and unhealthy eating behaviors, which are often patterns established early on that carry into and through adulthood, presenting ongoing challenges throughout a person's lifetime. There are different ways to prevent this, different lifestyle choices that can be made, and a lot of this can be supported in our classrooms as well. A referral is made by sharing observation and screening tests results with a child's family and assessing them in identifying appropriate follow-up resources. Usually a referral to a healthcare provider or to a different, more intensive kind of an evaluation is a decision that's made with the community most closely tied to that child, and that might be just the parents and the teacher, the parents, the teacher, the director, or something along those lines. But it's usually a community choice.